Cat 1, people who are in this category of Cat 1, N95, NIOSH and OSHA approved masks is the mask that you're wearing to prevent your... Alright folks, if you've suddenly dropped into this video, do check out the previous part of it because this is a continuation of a series. So go ahead and click on the link at the top and so that you can see high-risk categorization for COVID-19. This is going to be what all the necessary steps you are going to take if you are in those sort of categories. So it's very important to go ahead and check out the first part of it. And those who have already done that, this video will take you to the next part, which is going to be high risk categorization, preventive measures. Let's begin. Yourself from getting infected, you should do this. Forget surgical mask, try to get an N95 from somewhere. Highest probable hygiene practice, like this is should be a no-brainer. Hygiene should be at #1 for all categories. Like this is of prime importance. Goal to improve immunity, which means that you have to talk with your physicians, and obviously they are going to work with you, and obviously they are trying to boost your immunity, but there are a lot of factors that is concerned to your immunity. Avoid outside food, which means that do not eat at restaurants or anything. You can cook home all the time. Smokers, call CDC helpline. The helpline number will be out here. Why? Because it's already time to quit. If not, reduce from 1 pack to 2 a day. I think you'll be doing yourself a favor. Gloves, let's talk about this. Myth, a common myth that gloves is going to prevent me from getting infected. Well, our gloves can actually increase the infection threefold. Why? If you are a non-healthcare professional and you do not know how we use masks, this is what's going to happen. You're going to use mask, you're going to put your hands and take that mask and rub your face or anything. Nope. If you are using any sort of gloves or anything, you cannot put your hand on the face at all. So if you are using gloves, you have to make sure that gloves are cleaned with Lysol. You just have to smear it and then you have to let it dry. Only then you can reuse our gloves. Usually we use the gloves and then we throw these gloves away. So that's one time use only. If you still want to use gloves, it's upon you. Gloves should be recommended for those people, those who have any sort of cuts, any sort of atopic dermatitis or anything, and they have infection, any sort of fungal infection in their hands. Gloves will be recommended for them. Hand wash is very, very important. I mean, no brainer. Temperature chart and weight loss to gain chart. Alrighty, so we talked about temperature chart, we talked about weight loss and gain chart and everything, and you have to make sure that you are doing this just by simply reading temperature every day and making sure any sort of weight loss or gain, you are documenting that again in a book. You do not know how much we physicians, we appreciate if we see anybody taking that chart. That shows that that individual is caring for their health. So it would be highly appreciative if we all take this combined approach of making these charts at home rather than like asking like to do this at the time of distress or anything. Well, next comes a very important factor of mill workers, right? Is a mill worker or a cotton wool worker from any sort of like place, will they watch a YouTube channel? No, right? So how am I going to spread this message? Well, this is your job. This is your job to spread this message, and if you see a poor person, help that person by spreading this information to him that he or she is at risk and he or she needs to take this proper measures. So make sure if you see somebody, you say something to that some person, and that is the whole purpose of this channel. I do not need you to subscribe or anything. I just not need anything. I just want you to spread this information so that they know what you have learned. Less stress. Less stress is a very important thing, that all these individuals, they cannot be precipitated to stress. Again, I've been telling from day one that stress precipitates a lot of factors, and a lot of health issues are stress related. Well, practice, I don't know, like do whatever it takes to make your stress less. Some people practice meditations, some just does relaxation exercise, whatever helps you to make your stress level go down. To be very honest. Food habits. Food habits is a very important topic again, and I think I should not cover this right now because food habits should be covered in a separate episode. So we'll cover that later on. Diabetes. If you are a diabetic person, you are going to follow all these stuff that I've told you right now. And apart from that, if you see you're having high temperature or anything, you are contacting your physician. If you think you have a bad tooth or you have a toothache and you're getting temperature or rise of fever or anything, you're going to contact your physician. It's very important that you do this because this is going to be a very important factor after everything goes back to normal. Well, going back to normal is out of the scenario right now, but things are going to open up, economy is going to open up, and these are the factors that we need to take care of. Asthma patients. So asthma, again, very important factor again of asthma. People those who suffers from asthma is that corticosteroids are used for their long-term maintenance and everything, right? So if you see that you're not getting relief with medication, and apart from that, like your cough is continuing, usually it always subsides and everything, and medications it's not working or anything, do not do anything. Call 911, head over to a ER, let them manage, and then you call up your physician. I think usually ER people calls up your physician in US. Outside US, scenarios might be a little bit different, but if you ever face problem and you see your medication is not working, head over to the ER. Cat 2 patient, Cat 2 PPE is again a must. It's a must. If you're a retail employee, go ahead and ask your managers for PPE use. Okay, so every 2 hour an employee in US I think gets 15 minutes break or anything. So clean your hands at that 15 minutes. Do not share your lunches or anything with your co-employees. Do not sit down and share stuffs with your co-employees. That's for the Cat 2. Non-vaccinated, please go ahead and call your physician if you would require vaccinations, because I don't know why you were not vaccinated, but if you want to go for the right side, head over and contact your local physicians and make sure you are taking all the vaccinations. GIT is a very important thing because right now there is the FDA has not cleared ranitidine, famotidine, and zanitidine, and this whole class has been stopped because of something called NDMA, and NDMA is an agent that causes or predisposes you to cancer over a long-term use. So make sure you are asking your physicians, for other sort of drugs apart from not ranitidine. I'm 100% sure they already know. I do not know whether other countries know or not, but out here this is the scenario. So you can ask your physician for a different sort of drug apart from ranitidine and famotidine or anything. Cat 3, well, Cat 3 are the people those who are in home. So PPE use is must whenever you are going outside. You can wear surgical masks and just cover up your face and everything. And that's it, folks. That is the end of today's episode, where we went through a list of at-risk individuals. I made this whole list sitting down and working for like few hours, and I started actually yesterday only for the reason because nobody is making at-risk individual lists or anything. This is a very important chart because if we do not come up and make up this chart, there will be false information that will be spreading around. These are not authentic guidelines or anything because nobody is making guidelines. Until and unless guidelines are not posted, I am going with this. Until and unless guidelines are not released, I'm going with this. So thank you for watching. I hope you guys do well out there. Stay safe, and things are going to go back to normal within a couple 15 days or so. And when you head out, make sure you are taking these measures because cure is far from near right now, to be very honest. And see you guys on another episode. Goodbye.